For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hello, and welcome to Tiburcio Vasquez Health Center. My name is Andrea Schwab Galindo. I'm the Chief Executive Officer here. We are a federally qualified health center established in 1971, and we're a leading provider of multiculturally and linguistically appropriate care. We provide services we provide medical, behavioral health, dental, robust case management, and nutrition services. We have locations in Union City, our clinic's a couple of blocks from here, Hayward, San Leandro, Ashland, and Fremont. On behalf of our board of directors and staff, we would like to extend a warm welcome to Governor Gavin Newsom and his team, Supervisor Richard Valle, Union City Mayor Carol Dutra, Dr. Clannon, who's representing the Alameda County Healthcare Services Agency, community partners, and members of the press. It is a great pleasure to welcome you all. In partnership with the Alameda County Fire Department, Hayward Fire Department, City of Union City, and the Lady of Rosary Church, we have established this vaccination site 6 weeks ago and are currently working with our community partners at Eden Church in Hayward to host walk-up clinics that do not require an appointment. Like has been the case for many, this past year has been particularly challenging for our local community, even more so for people of color. Over 92% of TVHC patients are BIPOC. Of those 92%, 74% are Latinx. More than half of our patients earn less than $22,000 for a family of 4. Our patients and community members have been disproportionately impacted by this pandemic. In fact, in August of 2020, our average positivity rate for our patients was 29%, compared to the average of the county at about 8%. Because Black, Indigenous people of color, both today and historically, experience poor outcomes due to systemic inequalities in our healthcare system, many were hesitant to get tested or like now, vaccinated. Knowing this, TVHC used trusted messengers who have worked hard to reach those that need us the most. From our promotoras, who some of you were able to meet outside, they have reached over 1,500 families in a 6-week period. Our providers and community partners also provide fact-based education to address vaccine misconceptions and fears. Our street team as well has been going to the unsheltered to provide vaccines. Since then, we have done what we do best, address community need in a culturally and linguistically appropriate way. As a small health center, with the support of our community partners, we're achieving both equity and volume. To date, we have administered nearly 45,000 doses. That's no small feat for a community health center our size, who served 26,000 patients last year. We have been able to do this because of the dedicated mission and driven staff at TVHC, like you see here, and our great partners and elected officials, despite the hesitancy for vaccines in our BIPOC community. Our patients and community members trust us. Our elected officials and funders know that for every dollar invested in our health center, we're able to turn it into vital resources that our patients and our community members desperately need. Thank you, Governor Newsom, and to our elected officials for prioritizing equity, recognizing the critical role that health centers like ours play in addressing inequities and improving access. We are extremely grateful for the investment that has been made to protect the health and wellness of our community. Because of these resources, we'll continue to work hard so that we're closer to our new normal. Thank you.
Good morning. My name is Richard Valle, Alameda County Supervisor for District 2, which includes the City of Union City. Este año, el 2021, es el año de esperanza y también victoria para toda la gente que vive en esta comunidad. I'm here to thank the governor. The year of 2021 in our neighborhood is a year of hope and victory. Hope that his presence will bring reassurance to people that getting vaccinated is the right thing to do. And then in the end, that we bring victory to our neighborhood and raise up all the people who live in our neighborhood Through his shared experience and his testimony today, and through his encouragement, we hope that more people will get vaccinated. We are a very modest neighborhood that makes ends meet by collecting bottles and cans to put food on the table and pay the rent. We sincerely appreciate the governor's presence today, and thank you so much for honoring us with your presence. Thank you.
Thank you very much. The governor just said to me, once a mayor, always a mayor, referring to his prior service to the city of San Francisco. So I appreciate that. I want to thank the governor and his team for coming to Union City today. In Union City, we have been very concerned about the equity issues. So when Tiburcio Vasquez became a provider of these shots, it was near and dear to my heart coming to Our Lady of Rosie Church, which is where we are today, which is where myself and the supervisor grew up, and one of our council members that here lives in this area as well. So, Governor, thank you so much for being here today and recognizing Union City and the great work that Tiburcio has been doing. We appreciate it and look forward to this pandemic coming to an end.
Thank you, Mayor, and thank you, Mr. Supervisor, and Andrea, thank you, and to the council members that are here, our health director, to each and every one of you, and most importantly to Our Lady of Rosary for the privilege and opportunity, not just to be here to speak with each and every one of you and update you on our progress as it relates to addressing this pandemic, but also providing these life-saving vaccines to thousands and thousands of community members. It's because of the good work being done here and all throughout the state of California that the state of California now has the 6th highest administered doses of any nation in the world. The state of California has now administered over 24 million doses of vaccine. We lead this nation by some 8.1 million, more than any other state in this country. Texas has done well, but the state of California is administering doses at scale. Accordingly, we are committed to the cause that unites each and every one of us, and the cause and the spirit that was advanced in the 3 speakers and their comments, and that's the issue of equity. It's been stubborn, and it's been hard, but it's foundational. And we are not going to take our eye off that ball and eye off our responsibility to do more and to do better to advance that cause, as we announced today that every Californian is now eligible, regardless of their age, 16 and over, to receive and have access to vaccines. Today marks 3 milestones of sorts. Today, not one county in California is in the purple tier. Every single county in the state of California is out of the most restrictive tier. Number 2, roughly 50%, half of the population in the state of California that is eligible to receive a vaccine has done so. 49% to be exact. By midnight tonight, likely we will pass that threshold. Half the population, 50% of Californians that are eligible to receive a vaccine have received a vaccine. And notably, as the mayor was reminding me, she has a day job in addition to being mayor, and that's working on tax policy. April 15th, officially in 2021 in the state of California, is not tax day, it's Vax Day, meaning every eligible Californian, again, can now access the administration of a dose of vaccine. And while it is true that we had a temporary pause, a temporary setback with one of the approved vaccines, J&J represents just 4% of our weekly dose administration. So we more than able to make up for that with Moderna, which is being supplied here at this site, and the Pfizer vaccines, which we anticipate will increase in terms of availability and manufactured supply. The only constraint in the state of California in terms of administering more doses is manufactured supply. We administered over 2.7 million doses of vaccine last week, 517,000 doses in the last 24 hours. 2.7 million in the last week. We have designed a system where we're capable of more than doubling that to 6 million vaccines a week. Again, the only limitation, the only constraint is manufactured supply. We are looking forward to getting more vaccines in more arms for one fundamental reason: it saves lives. These vaccines are safe. These vaccines are effective. These vaccines will get our kids safely back in person in school. These vaccines will quickly and safely get our economy moving again in a sustainable way, getting our small businesses back up on their feet. We're already seeing signs of a recovery in this state. We talk about California roaring back. Well, let me give you a proof point about that. In February, the national jobs numbers came out. 37% of all the jobs were created in the United States of America. 37% came from the state of California. And that doesn't surprise any of us out here. The industry that's been hit most hard by this pandemic, the industry that's been most impacted by this pandemic, broadly defined as hospitality and leisure. That's the industry that's going to come roaring back. 102,000 of our 141,000 jobs in February were jobs in the hospitality and leisure industry. That was February. Wait till the March numbers come out. This state is ready to come back, come roaring back. But again, foundationally, the architecture of that is getting more shots into people's arms. And 50% of eligible Californians is good, but it's not good enough. And we are not prepared as a state, as a nation, in the world more broadly, that we're trying to build around, to run the 90-yard dash. We have work to do, and that work is manifested at the local level. There's no substitutes for sites like this. I know there's a lot of focus and a lot of energy on these mass vaccination sites, but the backbone of our vaccine delivery system is communities like this, clinics like this, partnering with churches just like this with an equitable mindset, an equitable framework, doing that hard work every single day, individual by individual, 100, 2, 3, 400, 500 doses in people's arms, at mobile sites, at fixed sites, meeting people, as was stated, and I love these street teams, meeting people quite literally where they are. Yes, we're blessed to have those two larger sites, one here in Alameda County, one down that is supported by a lot of federal employees down in Southern California. But that's additive. The critical work continues to be done with clinics and with partnerships like this. The state has now created a framework of support where there are 337 community-based organizations we have partnered with. Some $52.7 million has been invested to do exactly what you were saying, to focus on trusted messengers, in-language outreach, neighborhood by neighborhood. The Promotores program, we talked to a number of their leaders that are here, quite literally knocking on people's doors, block by block, door by door, and reaching out to people that may be hesitant, may have concerns, and may offer new considerations based upon the feedback and information they're receiving. Again, we are continuing to focus on those outreach efforts. Because we're opening up this vaccines to everybody doesn't mean we're letting off or stepping back from that commitment. 40% of these doses continue to flow towards this equity metric. We talk about that 24 million vaccines. The number that I'm most proud of, though not yet satisfied with, is the 4.84 million that have gone into our most impacted communities in this state. Those 4.84 million vaccines that have gone into what we refer to as our Healthy Places Index Quartile 1. And if I've lost you, or if I haven't lost you, you weren't paying attention. The HPIQ1 is really an important metric of our success in terms of meeting these equity goals. But as I state, we still have a lot of work to do. And so we are here in particular highlighting those efforts, highlighting one of those zip codes and those census tracts in our state, highlighting the good work and partnership of these trusted messengers you see behind me, and celebrating this milestone here in the state of California in terms of availing these vaccines to all Californians 16 and over. If you haven't taken the time to get a reservation, go to My Turn or call your local health officers. Go on websites, find out which vaccine distribution site, could be a pharmacy, could be a clinic, could be a mass vaccination site. Find out what's most proximate to you and get a reservation. More and more vaccines are coming in. These vaccines remain safe. These vaccines remain remarkably effective. Final words. It's just incredible to consider where we were just a few months ago. Today, California has the lowest positivity rate in America, which is a remarkable statement of a state as large as the state of California, with the lowest positivity rate in America. 24 million doses of vaccines have been administered. Roughly 2,300 people are hospitalized, proving still how deadly this disease is. But consider in January, we had close to 23,000 people hospitalized. 22,300 was the peak number. Today, roughly 2,300. We are making progress. We're going to defeat this disease. We're going to end this pandemic. There's a bright light at the end of the tunnel, but we still have more work to do. Final words. Please be mindful that this disease is not taking the month off or the summer off. This disease has not gone away. The only reason we are enjoying the lowest positivity rate in America is because of all your hard work. It's because of not only those of you that have availed yourself to life-saving vaccines and have shown yourself as an example and a leader in your own right by doing so, but it's also all the other important work that is done every single day with non-pharmaceutical interventions, meaning wearing face coverings. Let's not let down our guard. Let's not take these masks off. We still have work to do. The biggest mistake in this country that's being perpetuated are people that are just giving up and not requiring these face coverings and just assuming that mission somehow is accomplished. It's not. This disease will come roaring back. Ask the governor of Michigan. Ask folks around the rest of the world, the rest of the globe. Large economies shutting back down in places like Italy, France, challenges in Germany. These variants. We have a UK variant. 20% of all the March cases that we have currently sequenced, 20% of them are the UK variant. 53% are the West Coast variant. These mutations are deadly. These mutations are real. These vaccines are a race against these variants, a race against these mutations. Let's keep our guard up. Let's take this moment seriously. This is an exciting and proud day because now we have lifted that burden and that anxiety around age and conditions and availed every Californian 16 and over the opportunity to get these vaccines. But now the hard work is inside of each and every one of you to manifest that ideal, to get us to June 15th, to get us past this pandemic and back to a sense of normalcy and allowing ourselves to, with all of the vibrancy that is inside all of us, to come back, roaring back as Californians as we will. So thank you all very much for all of your incredible work, all of you. And thank you to 40 million Californians strong for the remarkable job you've done for this very, very challenging year. Mindful that June 15th is just a few months away, but we've got a lot of work still to do. With that, of course, we're here to answer any questions. Oh, there's a mic. Forgive me.
Sorry, they said get behind the mic. Matt Bigler, KCBS. Governor, my wife and I got vaccinated a couple of weeks ago. We got the Moderna shot. We're very happy about that. But we had to go to Paso Robles to get it. We live in Alameda County. We couldn't get an appointment locally. My question for you is, why is it that it's so much harder to get appointments for vaccinations in the Bay Area? And what's your message to people who realize I can get an appointment today, I'm eligible, but I can't find an appointment?
Well, the challenge is manufactured supply. The challenge is that this state has designed a system where we can administer 6 million doses, but this week we're only receiving 1.9 million. The challenge is manufactured supply. And so the issue will resolve itself as more Moderna and more Pfizer make their way into the state and throughout the United States. But that's foundationally been the constraint and been the challenge in the state of California.
Hi, Governor. Deborah Kahn with Politico. The question's about oil drilling. You'd asked lawmakers to bring you a bill on fracking. It died in its first hearing on Tuesday. You'd said you weren't familiar with the details. Would it have helped if you'd gone to bat for it at all? And what happens next?
I was very familiar with the details, so forgive that information wherever it was received. I was quite familiar with the details, and the authors are our close allies, friends, and we have work to do. And I'd like to see fracking end, I said by 2024 in this state, and we're going to work hard to advance that cause. Now, put it in perspective, fracking's less than 2% of our total production in this state, and that's why we have commensurate strategies to address our low-carbon green growth goal. None more important than changing demand, and none more profound and significant than the state of California becoming the first state in the nation through an executive order that I signed, soon to be codified by the California Air Resources Board, to require that all cars sold in the state of California be alternative fuel cars by 2035, the first state in America to do that. To me, that's game changer in terms of consumption, in terms of emissions. In addition to that, we were clear in one of the many executive orders I've signed on the issue of climate that fracking should begin to transition out, and we are committed to that cause. And while this bill that had many different components, not just fracking in it, fell short in committee, it shows you how challenging it is, even in a democratically dominant legislature, in order to advance that cause. But we're creative, we're resourceful, and you'll be hearing a lot more from me on this topic very, very shortly.
Hey, Governor, this is Ben Christopher from Cal Matters. Thanks for doing this. 2 questions for you, if you don't mind. First, just wondering if you could give us an update on My Turn, how it's handling what I assume is an onslaught of traffic today, given the new eligibility rules. And then also an unrelated question on broadband. Wondering if you could give us a preview of the types of resources that you would like to see directed to that issue through your May revise, and also whether you'd like to see regulatory changes on top of the additional resources.
Yeah, so on the issue of broadband, I think we're just resolved to solve this once and for all. We've been talking about universal broadband since I've been in diapers. And it's been stubborn. Now, I've only been governor a couple years. It feels like 20, 30 years. Some feels like century. So we're just getting going here. And I put together a work group, updated some of our data information, did some new mapping with Esri on where the hot spots were and where some of our deserts in terms of access points are and download speeds. We put out a framework. If you see what we refer to as the A pages in my budget in January, we had a lot of language in this space sort of showing resolve in our commitment to advance the cause of universal broadband. But never did I expect, and forgive me for the long-windedness of this answer, but it's an important point that I hope to be emphasizing here in a second. Never did I imagine the support we would get from the federal government to actually make real this effort. And so I am very confident in our capacity to put forth in the May revise, to your question, a substantial amount of money to adequately advance. This is not going to happen overnight, to advance the cause of universal broadband once and for all in the state of California. This is an extraordinarily exciting opportunity. And what I'm very grateful for, and I just want to extend that gratitude publicly, it's incredible leadership in the Assembly and the Senate on this subject as well. And that goes to the second part of your question. It's not just about money, it is about a regulatory framework. And there's a lot of moving parts in there, the CPUC, a lot of moving parts around existing programs, because it's one thing to have the capital up front on broadband, it's another to have the ongoing investments that are required to subsidize those that can't afford high-quality broadband and download speeds that are commensurate with our obligations to all Californians, regardless of their ability to pay and regardless of their geographic location. And so a lot of work in this space, but it's a very exciting time. And I hope that's a clear preview of a commitment, deep commitment in that May revise to advance this cause. Now, broader issue of my turn, I don't have the specific data today in terms of the reservations. At the end of the day, we'll have that and I'll provide that to you. But one thing that we know is a lot of folks got a jump start on today. And so a lot of folks were making reservations. They're not all making them today. Folks were starting to make reservations over the weekend. Some done so even earlier. And because we were getting so close to this point, we didn't make an issue out of that, and we're frankly grateful. In fact, I think this site, you started making reservations yesterday, right? And so anticipating that people would show up today. So we'll have a better sense when the dust settles exactly where we are in that respect. Thank you.
Good morning. Thanks for taking questions. I'm Marisa Kendall with the Mercury News. I'm wondering if the state is tracking the number of breakthrough cases or cases where people get infected with COVID even after getting vaccinated, and if so, how many of those have we seen so far?
No, in fact, I'm shaking my head. We just began tracking that. We've been tracking that, but I'm waiting for that data. And as soon as I have it, I want to make it public. In fact, Dr. Valle and I specifically yesterday were discussing and analyzing hospitalization rates in the state. And while we have roughly, plus or minus, roughly 2,300 folks that are hospitalized, we are trying to analyze exactly how many of those may have been vaccinated to understand exactly the concern that your question brings up. And so once we have that data, we'll share that with you, and we're collecting it. Remember, we're working with local health officers all up and down the state, and sometimes that data is difficult to track because it's difficult to collect even at the local level and then aggregate at the state level. But we are eager to share that with you.
Hi, Governor. Sarah Ravani with the San Francisco Chronicle. What's the status of the states or the Western states work groups review of the J&J vaccine blood clots issue? And when do you expect a decision will be reached on how to proceed with the vaccine?
No, thank you for that question. Our advisory committee, remember we have 3 committees as it relates to vaccine distribution. We have an advisory committee that met 2 days ago, and we have the Western States Safety Work Group that not only resides with members from California, but also from other Western states. They convened yesterday, and they made a determination that was consistent with the CDC determination that they required more data to be made available to ultimately make a determination. And so they are tracking very closely with the CDC, and will be reconvening once more information is forthcoming. But they formally did meet yesterday.
Dr. Erica Pan said yesterday that vaccine supply would be flat or down for the next 3 weeks. Can you say when supply in California will be adequate for demand?
As soon as Jeff Zients in the White House give us the information. That's the answer to the question. And I think it's a question that if you ask them would be an open-ended one as well. Here's why. It's, again, all around manufactured supply. The expectation is, and this has been reinforced, including Tuesday morning, when all the governors joined Jeff Zients, Dr. Fauci, and others on a conference call, that the manufactured supply by the end of the month will start to significantly increase, both for Moderna and Pfizer. The J&J, we were expecting by the end of the month and early next month. Obviously, that's on pause. But we do expect to see a ramp up of J&J and Pfizer. What's interesting, and I don't know if Dr. Pan specifically commented about this yesterday, and forgive me for not knowing if she did or not. What's interesting is what's happening is the federal government is now doing direct supply at a much higher rate as they're holding some of the state supply at a more consistent rate. Let me be specific. We anticipate 1.9 million doses this week, but the direct supply from the federal government is as high as 1.5 million doses, which is much higher than we've seen, including, by the way, to your clinics. Now, that's very good news. It's not bad news, including the pharmacy program. So you have community-based clinics and pharmacies that have more. The state's been held steady. And this is something we're seeing across the country. We don't know if that's temporary on the basis of the J&J pause, or that's something to anticipate over the course of the next few months, and we are inquiring in real time about that. That said, 1.9, 1.5 is not an insignificant amount. It's more than we've seen in the past, and that's good news for Californians. From my perspective, I don't care where you get it. I just want you to get it. I don't care how you get it. I just want you to get it safely. And I'm not sure everybody gets it, regardless of their race, regardless of their immigration status, regardless of their ability to pay. These vaccines don't cost any money, and regardless of your immigration status, you have the right to access these vaccines. And the more choice we give people, more voice in terms of choices as it relates to alternatives to Pfizer and Moderna, that's why we're hoping J&J gets reauthorized, is also foundational to us getting to where we anticipate and expect to be by June 15th of this year.
Good morning, Governor. Leslie Brinkley with ABC 7 News. Thanks for answering questions. I heard you talking to people outside about knocking on doors, and some people are thrilled to get a vaccine appointment. Other people are just closing the door and saying, I'm not interested. They want the J&J one-shot dose. How do you address that? Because if indeed the supply increases going into May, there's still that challenge of getting people convinced to get a vaccine.
No, that's right. Look, 517 doses administered yesterday, over 2.4 million and counting today, 24 million and counting today. So real progress. 50% of the eligible population in the state's gotten at least one dose. 73% of 60, almost 74, just shy of 74% of 65-year-olds and older have received at least one dose. So there's real progress. But there's still some hesitancy out there. And look, no one's naive. I took the J&J 2 weeks ago. I wouldn't mislead you because all you got is your veracity and truth. No side effects whatsoever. Absolutely none. And for 1 out of a million, there's been a side effect. 1 out of a million. There are a lot of other things we take for granted, even over the shelf, that have higher side effects than the J&J. So all that things have to be put in perspective. But I understand what the FDA did and the federal government did with a pause until we have more information, particularly because it was 6 women in particular during a particular time of life. And so it does beg some additional questions and research. So I thought there was wisdom to that, and we joined, obviously, in that call. That doesn't advance the confidence level. That would be misleading. Same time, we want to put it in perspective. And there's been nothing comparable with the Moderna and the Pfizer. But one thing we know is without the vaccines, when people of certain age with certain pre-existing conditions and complications, they're putting themselves at great risk by not getting the vaccine. And as a consequence, people continue to die. Over 130 people died yesterday in the state of California. This disease continues. It's taken tens of thousands of lives in this state. And it's no less deadly today than it was 3 days ago. And it won't be less deadly in 3 days from now. The only way to defeat this is with the vaccines and to get that R effective well below 1 and to eliminate this disease. At the same time, you've got all of these mutations and variants, which only should reinforce the imperative and need and desire for all of us that are eligible to get a vaccine, to get ahead of that, at peril that we find ourselves in conditions that some other states and nations have found themselves in. You can't let up your guard. This is a stubborn, stubborn disease. And I've said this 100 times. I said it yesterday. Some of you were with me. If there's one word for the last year, it's humility. Humility. I mean, a week ago, every governor that was on that Tuesday call was celebrating the J&J allocations. And a few days later, another roadblock. We work around those things. We work through all of these things. And that's been the cause that's united this country and, for that matter, the rest of the world over the last year. And I'm mindful that we're in the 4th quarter, unquestionably. But this game's not done yet. And we can't spike the ball, forgive the sports vernacular. And we sure as hell can't lay claim to mission accomplished.
Governor Pilar Niño with Telemundo, Channel 48. Do you have numbers of how hesitant is the Latino community to get vaccinated, and if the campaign in terms of numbers has been successful among them. Because we still have a lot of misinformation, and these stories with Johnson & Johnson doesn't help.
Yeah. No, we're still working. I had the privilege just last week to do some very targeted personal outreach to the Latino community all up and down the state of California. I noted that there are 337 community-based organizations that the state has partnered with. Many of those organizations are just ramping up. Many have been working hard over the course of the last number of months. Trusted messengers in language, disproportionate number, identifying the needs of the Latino community. We also just launched an additional $40 million PSA campaign in language with trusted messengers to reinforce the message of safety and efficacy of these vaccines. We have more sites than we've ever had with churches like this, over 300 church partnerships. We have more mobile sites and fixed sites, particularly to ag workers and farm workers. And we continue to build out that network. But we still have hesitancy in all communities, including the Caucasian community. And sadly and curiously, and in respects not surprisingly, based on your political affiliations. And so we have to work across all of that spectrum to address hesitancy. But I'm very pleased by the folks that I see outside here today that are proof that that hesitancy can be overcome and lives can be saved.
Just wondering about the first partner. You said that she was waiting till she was eligible to get the vaccine. Is she getting the shot today?
Yeah, I asked her this morning at breakfast. I said, "Are you getting your shot today?" She said, "I have a reservation next week." I said, "Why not?" She says, I've got, she then reminded me of my role and responsibility with my kids, and no sooner did that happen that I was working on my son Hunter's book report of LeBron James, and was 20 minutes late getting here this morning. So I opened up a whole can of conversation this morning. Perhaps that's too much information. She just got her reservation. She's getting it next week. That's all I should have said. I'm in trouble now when I get home. Anyway, I thought it was a good book report. I hope the teacher agrees. Anyway, my mind is now going. All right, thank you all for the privilege of your time. Thanks again for amazing work you guys are doing. Mayor, thank you, and the council members, supervisor, thank you to all of you. And let's get vaccinated, California, and let's get to June 15th. We're well on our way. Take care, everybody.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.